Hey everyone, Bianca Palmisano here from Intimate Health Consulting, and you are watching the Sex Advent Calendar, 25 days of sex education all through the month of December. Today we are talking about hormone therapy, specifically HRT for individuals looking to undergo gender transition. So the most common question that we get about hormone therapy is, what exactly do these hormones do? So if you are transmasculine and you're interested in taking testosterone, the things that you're likely to see from your medication is increased hair growth. So that's usually on your chest and on your back, but with some actual balding around the temples occasionally. Dryness in the genital area. So a lot of trans men refer to that as their frontal. And that is because the lack of estrogen means that your tissues aren't producing as much lubrication naturally. Increase in the size of your external genitalia. So some people would call that the clitoris. Some people would say it's their dick. But you would see an increase in the growth anywhere from 1 to 5 centimeters is pretty common. A lot of times you'll get oilier skin or acne. It really is like undergoing a second puberty. So that's the same sort of things that you would expect when you were a 13-year-old boy, you are going to see now. Some nice things: increased muscle mass, often a higher sex drive, and that your menstrual cycle will become irregular and sometimes stop altogether. And of course, your voice will deepen as your vocal cords start to thicken. If you are trans feminine and taking estrogen and androgen blockers, what you're going to see is a decreased ability to get and maintain an erection, and usually a lower sperm count and less ejaculate production. Your testes, your balls, are going to shrink, and your sex drive often goes down a little bit. Other folks report changes in the way that they experience orgasm as well. Your breast tissue is going to grow. So even if you never have top surgery, almost everyone that takes estrogen will experience some tissue growth in the chest area. You'll also experience a decrease in muscle tone and a redistribution of your fat deposits. So a lot of folks with higher testosterone levels will carry more fat in their abdomen, whereas people with higher estrogen levels carry it more in their hips and in their butts. So you will see that distribution change so that the hips become much wider and curvier. On testosterone, you'll actually see your chest and shoulders and back widen a little bit. And again, that has to do with the redistribution of muscle and fat that's happening because of your hormone levels. Another common question is, okay, well, if I want to take hormones, what does that look like? How do I take them? There are a couple different delivery methods for estrogen and testosterone. So usually people taking estrogen take it as a pill or occasionally a patch that you put on the skin. The reason for that is because injections of estrogen tend to lead to really intense mood swings. And so they are just not a fun ride. The pill or the patch allows for a much more consistent dosage of estrogen day to day, and lets that change happen very naturally. So you don't get the highs and the lows the same way. If you're taking testosterone, most commonly folks will get that as an injection because it has a higher bioavailability than patches, gels, and creams. Those are also available if you really don't like needles, or if you're looking for a slower taper into a masculine appearance, or maybe you're playing some chemistry alchemy where you're looking for a more gender variant or gender fluid expression, in which case having sort of a micro transition can be nice. The only thing that's a bummer about patches, gels, and creams is that they can rub off. So if you are using them, you want to make sure that they are dry or away from an area that your partner touches, especially if you're having sex, because that will then rub off onto them and can affect their body chemistry a little bit as well. The last question, of course, that most people want answered is, how do I get hormones? So it used to be that in order to access any kind of hormone therapy, you would have to go through a therapist or a psychiatrist because you would need to get a referral for an endocrinologist to get the prescription for your hormones regularly. This is sometimes still true, but a lot of places are now switching to an informed consent model of hormone therapy treatment. So that means that your doctor, whether that's a primary care doctor who has some knowledge about trans health and is comfortable prescribing hormones, hormones, or an endocrinologist will explain the risks of taking estrogen or testosterone and then prescribe it the way they would any other kind of medication. So it's the same as going to the doctor for a course of antibiotics. The idea behind informed consent is that you are an adult who is capable of understanding what the risks and benefits are of taking this medication. And so you should be trusted to make the best decisions with your body. Now, not everyone is totally on board with the informed consent model yet, but we are slowly getting there. If you do need a referral from a therapist, a lot of providers will actually host special meetings where you can get a referral letter. It's obviously great if you can have an established relationship with a therapist who can speak to your mental health and your desire for transition, but there are some providers out there who are very aware of the gatekeeping that the medical industry uses to keep trans people from accessing hormones and will specifically offer the service of writing a referral letter for you. Hopefully that answers some of your questions about hormone therapy. There's more information about trans health and about transsexuality coming up all this week. I'm super excited to have a number of guests joining me later. And as always, if you have other topics that you'd like me to cover, please message me at intimatehealthconsulting.com/contact. Thanks so much. Have a great day.